training in a group class 3 to 5 times a week will meet the fitness criteria. Yeah, so in my undergraduate years, in addition to biology, I decided to do a major in anthropology. And anthropology is really understanding the origins of the human species, how we've evolved, how we initially came together in groups and societies, all the way to kind of where we are now in our current modern society. Yeah, so going from studying anthropology, which is a whole human and all the different components of that human within their society, to medical school, which was really laser focused on different aspects within the human body. So we divide up everything. We have anatomy, we have physiology, we have cellular biology, we have microbiology. So we're really getting into minutia because so much of what has been developed on the scientific side of medicine is targeting these very specific molecules and markers that sometimes there's not really an opportunity to take a look at what's happening with the whole human. Yeah, I mean, I think it was a big part of the reason why I wanted to stay in primary care. Because at the end of the day, humans are not just what their lab values are. They're not just what their current medical problem is. You know, if it's a broken bone, or they've been through some trauma, or they're having an acute infection. Everything that happens is within the context of their human experience as well as in the context of their society. And so in primary care, we do have the opportunity to still interact with patients at that level, especially because many times they're coming to us for preventive care. All the insurance companies, since the Affordable Care Act, which was passed during the Obama administration, are required to cover preventive care. And the idea was that the patient should have an opportunity to build a relationship with their physician prior to actually getting ill. And ideally, through those interactions, receive information and education and direction about what tests and interventions would help prevent some of the conditions that can occur in later years. I think primary care physicians and nurse practitioners and physician assistants who practice primary care are overwhelmed because we hardly see a healthy patient. We're supposed to be taking care of people before they fall ill. But the truth of the matter is, for example, if you look at the obesity rates and chronic disease rates in children and adolescents, we hardly see adults that don't have any health conditions. And so from the get-go, it's like we're trying to catch up or restore something that's already been lost. And so we don't really have the opportunity to think about, oh, here's a healthy human. Let me look at what this healthy human is doing so that I can keep them healthy for the next 10, 15, 20 years. And honestly, even though I had been through college at Emory, medical school at Emory, business school at Emory, and residency training at Harvard, I never encountered those humans until I started training in the CrossFit space. So we actually have these numbers because this year we were part of a small network within our county called Ambetter GC Select. And recently we reviewed the statistics within that population, which is about 10,000 patients, how many have actually received their annual wellness visit, and it's less than 20%. I think partly they don't know. They don't understand how to navigate the health system. Many of the people in this particular planet are immigrants, or English is not their first language. They're not as familiar with the services that are available for them. And then I think a lot of people don't want to necessarily know. They already know they're living a healthy life, aspects of an unhealthy lifestyle, but they are maybe afraid or don't want to get a diagnosis. They would rather just kind of wait until they actually experience something and then address it. Even though that's almost like self-sabotage, I see that quite a bit. And why do I see that? Because they come in when they have a sinus infection, or they come in when they, sprain their ankle. And then when we ask them, what would you like to do your annual wellness visit, or why haven't you done your annual wellness visit? This is exactly what they tell us. They don't want to do the screenings or get a diagnosis. So I think it's multiple layers of lack of education, some fear, as well as not knowing once they get that diagnosis, what are their true options going to be? Are they going to be told they have to take a medication forever, or are they going to have other options? Because it's really hard to do, I think. It's behavior change, it's education, it's a lot more work than writing a prescription, which now isn't even writing, you just click a button in your EMR. I think physicians, just like all humans, want to approach a task, complete the task, and feel good about the task that they completed. And that's easier to do when you're doing a surgery or a procedure or a treatment course, like a medication course. It's a lot harder when you're on a journey with another human throughout their entire life who has setbacks, who has emotional things come up, who might lose their job, and still trying to keep them on track for healthy habits. I mean, healthy habits are the key part of prevention, because this is what you're doing with your body every day on a consistent basis. So it's how you're eating and nourishing your body, it's how you're moving your body, it's how you're taking care of your body with things like sleep and stress management. All of these components impact your immune system, your resilience, your ability to cope with any acute illness or injury. So this is your baseline, it's your foundation. So I think this is where we're in a unique position, because when you're given the license to practice medicine, you're actually given the responsibility to provide the best possible treatment and or care, whatever is the situation for your patient. Not only is that a legal obligation, but it's an ethical obligation. And so I think when we look broadly across what we're doing as a physician community, we need to really ask ourselves, are we providing the best possible options to our patients? Have we made every effort to look around, look outside of just the medical literature at what's happening in the world and see, where are the healthy people? Where are the healthy people and what are they doing? Physicians were initially called upon to be scientists who study human physiology and pathophysiology and discover ways to improve the human condition. And science starts with observation. And I don't think too many physicians have looked outside of what's just put right in front of them by the medical system to say, okay, what are these people who are living well and living healthy lives and not needing medication or treatment for chronic diseases in their 50s, 60s, 70s, and 80s? What are they doing? And how can we make that accessible, affordable, and scalable? Yeah, we're not only just stuck in the forest, but it's like we're stuck in the forest looking at this one tree that we've been told to look at, and we have blinders on about what's happening over here and over here, where people are, again, losing trust in the medical system, because sometimes what they hear from the medical system is going, again, against what they're seeing. And if the physicians don't open their eyes, look around, and see the same thing that their patients are seeing, then they're going to, again, not be able to really understand it themselves or provide the right treatment or preventive prescription for their patients. And this has, I think, been the real surprising success of DC Healthy Living, is that when I talk to patients, their eyes light up, that they're hearing for the first time in a medical setting a conversation about what might actually work to reduce their need for medications, prevent the need for future medications, reduce the number of chronic disease diagnoses that they have, which they've seen happening or heard about, but never in their physician's office. And so the patients who have been participating in the program are the ones who have been understanding more and more receptive, and then of course more successful in their results sometimes than the rest of the physician or healthcare community. I think that the ones who opt into the program have oftentimes already come with a perspective that maybe either medication is not the best option for them in the long run, or they've seen and experienced for themselves, like they were on one medication, then two medications, then five medications, but they feel worse than ever. And so they're open to hear an alternative. And then when we connect them with the enthusiasm and passion that our coaches bring, who also have the time that the physicians themselves don't have to provide the education, training, the coaching, then they start to see results. And the people who opt not to participate, they're not quite convinced that this approach will be successful. And I think that's what I would really like to work on over the next year is how can we show other physicians as well as the other patients who are not opting in to make some habit changes that we as physicians are telling them are the correct changes to improve their health. How can we help them to see that it's worthwhile for their time, it's going to benefit no one else more than them if they do decide to opt into it, and that it's truly a better alternative than prescribing the medication. You know, when the patients opt not to participate, we still prescribe the medication because why? It's still better for them to have an A1C of 7% taking 3 medications than an A1C of 12% taking no medications. So again, we have to always think about where the patient is and provide them the best possible care that they're willing to receive. So the components of a healthy lifestyle that I believe are universal. And I'd be happy to hear if somebody thought there would be something that they disagree with, but it's to eat 3 meals a day with adequate protein. And adequate protein for somebody who's not doing super intense training is going to be, around 0.7 grams per pound of body weight, especially as they're getting into their middle age and older years. They may be higher if they're training at a higher level. 2 to 3 servings of fruits and vegetables per meal. And that's on the nutrition side. On the fitness side, at least 150 minutes a week of cardiovascular exercise. So what do we mean by that? It's intentional movement that raises your heart rate into zone 2, zone 3 range, which was a little above 110, 120 for most average adults. Twice a week strength training at a minimum that hits all body muscle groups, and twice a week a little higher intensity, even if it's just for a few minutes where they touch that max heart rate. So that's on the fitness side. 6 to 8 hours of sleep per night for most adults, and access to health professionals and other tools that can help them with their stress management and mental health. I think that the traditional CrossFit model, which is training in a group class 3 to 5 times a week, will meet the fitness criteria. If you really go there, put in your full effort, 5 days would be better than 3 days, but somewhere in there consistently will get you really close. And then the initial recommendations about nutrition, which included reducing excess processed carbohydrates, prioritizing protein, and prioritizing fiber, fruits and vegetables, I think it kind of fits those 2 components pretty well. So I think people say that because they think not everyone is willing to put in the effort. But from my position as a physician who's focused on primary care, it's important to me to tell everyone that they should. So I think, why did I want to start and build Juicy Healthy Living? Because I think everyone should, first of all, be told that this is part of how they can live their best life. Second, they should have access to the education and information and training to achieve that. And third, as they come in and out of the primary care office, they have multiple opportunities to consider participating in these types of lifestyle changes. And when we look at, human psychology, not everyone is always ready for change at the same time, but I do think everyone can be ready if they receive the right guidance and the resources and different opportunities to get started. I think that if any physician looks at the diagnosis that they treat, it will be hard to find any specialty that doesn't treat a chronic condition or even an acute condition that's not impacted by lifestyle choices. So for example, even if you're a nephrologist and you primarily deal with chronic kidney disease, most of that chronic kidney disease is coming from years of hypertension or years of diabetes. In neurology, for example, you treat sleep apnea patients. Many of those sleep apnea patients are having a diagnosis of sleep apnea because they're obese. So again, I think if every physician considers, is a condition that I'm treating something that would benefit from a healthy lifestyle or changes in this patient's lifestyle? And if so, what are those preventative steps that they need to take or habits that they need to change? Or even if they're dealing with an acute condition that has nothing to do with their previous habit choices, would they benefit from making habit changes that would speed their recovery or improve their outcome? I'll give you a good example. I had a patient yesterday who was in a plane crash, a small plane crash, a young woman, doesn't really go to the doctor, hadn't had any kind of checkup. She's young, so she has a big laceration on her foot, big bruises on her legs, and she came in to have her stitches removed. And she got so sick and dizzy after we removed the stitches. And I asked her, what did you eat for breakfast? And all she had for breakfast was a pastry, a donut pastry. And I told her, you have these big injuries. You've just been through this big accident. You need to be eating protein to ensure that you heal well and you heal adequately. And that's probably part of the reason why you don't feel well right now, because you didn't nourish your body this morning. And I think that's a great example of how all of these things that we're talking about are so simple and basic that even if you just have an accident and need to recover, it helps in that process versus when you don't have these habits in place. Yeah, I think it's actually, I want to be completely honest and say we've been in a lot of CrossFit gyms, and not everyone that you meet in a CrossFit gym is necessarily following these lifestyles. However, you find a few. And I think part of it is that there's just really not too many people who are doing it consistently on an ongoing basis. I think we're really lucky in our program to have Kim Hockman. I think she's a great example. I'm not going to reveal her age. I think she's a really great example of someone who has been living this lifestyle for 15 to 20 years. And so not only just has done that for herself, but decided on her own to get coaching certifications and further education in functional medicine so that she can share that with other people. So I think that we need to find these people if they're interested in coaching or being a part of a larger system. Give them an opportunity to do so and put them in connection with physicians. I really think the reason why most physicians have no idea about this is because they never met anyone who's doing it. So when you study the literature and then when you look at these examples, Katina Thornton is another good example. She's in the CrossFit physician community and she lives all the aspects of it. And we need to highlight that and share it. And I think these individuals also they're relatable. She's an anesthesiologist. So we need to have these people interact with the rest of the physician community. And then I think second, super important, is to give physicians the opportunity to do this. And like you said, it may not be in the traditional way because of their schedules and other limitations. So we need to build programs that work around those limitations so that they can also experience it for themselves.